Yes, greetings, my dear friends. I am Professor Edin Dibuago. I'm a professor of public health medicine. And we're interested in creating awareness about this prostate cancer issue. Currently, we're going to talk about the types and then how do you make diagnosis of prostate cancer. Essentially, most of the type is what they call adenocarcinoma. That is the most common type of prostate cancer. Then there are very rare types like small cell carcinoma, there's a transitional cell carcinoma, there's neuroendocrine carcinoma, and there are the ones we call sarcomas. All these are types of prostate cancer, but adenocarcinoma is the main type. So that is the types. But when you come to staging prostate cancer, this staging generally depends on what you find clinically. What you find clinically is what you find when you interact with the patient as a doctor, when you examine the patient, and then the investigations you do, the results, So, and then you have the pathologic classification too, based on what you find when you take specimen and get them to the lab, the result you get, and whether the disease, after the operation, what you also find after operating on a prostate cancer patient, whether the disease has spread beyond the prostate gland and affected other surrounding tissues. All these are the factors you put together to stage the cancer. Great. Clinical staging, clinical finding, you start when you examine the patient by what they call digital rectal examination. Digital rectal examination, not really direct. You put your finger in the patient's anus and then you feel. The doctor should be able to say, like, the consistency of the prostate. Is it hard? Is there blood in your examining finger and all that? So you put it together and put in stages. Then you do PSA. PSA screening is a blood test we do for prostate cancer. But know that high PSA doesn't always translate to prostate cancer. It could be other things. Your PSA could rise as a result of inflammation of the prostate. So once you have high PSA result, do not panic. So let the doctor do further assessment and tell you what it is. So that is one of the things we use in staging prostate cancer too. And then when they take the biopsy is a piece of taken from your prostate. If they take it to the lab and then the result comes out, there's what they call Gleason staging. The denominator is 10. If it is 6/10, it's from 6/10 to 10/10. If it is 6/10, that means it's very low risk cancer. Some cancer, prostate cancer, can be low risk kid, and you do watchful waiting, especially for old men, and it's okay. Then if it is 7, it is intermediate or moderate, prostate cancer. And then, but if it is 8 to 10, that is high risk, my brother. That is the one you really should run and then do something to check. If you're still in early stage, like total robotic prostatectomy will solve it. So that is the staging. Then after that clinical staging, the pathologic staging, like I said, lies on the specimen you take. That is the biopsy. They take it for histology, pathology lab, and then look at the cancer. And then it's after that, during that pathologic staging, that they talk about Gleason scaling. And then also, when you do operation and you remove the prostate, the prostate specimen you're bringing out, you take with it some bits of lymph nodes, the tissue surrounding the prostate where it was located and all that. So whether the cancer has gone beyond the prostate, affected other ones like seminal vesicles and all that, those are the things you use in staging. And broadly, when you put all those things together, you put them into 4 stages. Stage 1 is when you just have like Gleason scoring of 6, it's low risk. And then the PSA is not more than 10, is stage 1. But when the PSA is above 10 and getting to 20, and then the Gleason scale can be 6 or 7, that is intermediate. You find out you're in stage 2. But when you get to stage 3, the PSA is higher, and then Gleason scaling could be more than 7, it could be from 8 to 10, and then you find out it's stage 3. But then in stage 1 and 2, you find out the prostate issue. The cancer is still within the prostate gland. It hasn't gone beyond the prostate gland. But when you get to stage 4, the cancer has gone beyond the prostate gland. It has spread. It could affect the pelvic bones. And you'll find the Gleason scoring could be a lot higher. The PSA is a lot higher. So that is a very dangerous one. Those are the ones really that run very fast course, Very aggressive cancer when it gets to that stage, and then especially if it is a high-risk type, it's aggressive, and the chances of survival is low. That's why we must all work hard and ensure no man from now gets to that stage, especially after listening to this talk. That is about the staging of prostate cancer. Let's talk about how we make diagnosis of prostate cancer. Like I mentioned before, that you have a high, so many people panic when they have high PSA, and that's why so many people are scared of going for this screening. I've spoken to so many people say, no, if my PSA result is high, I'm dead, I will die before anything and all that. No, high PSA screening is just screening test, trying to see is it possible. It's an indicator that there might be something wrong, but it's not conclusive. So many people with high PSA, they find out the PSA is caused by other things like even benign enlarged prostatic hyperplasia, like we mentioned earlier. Things like inflammation, prostatitis, inflammation of the prostate gland gives you high PSA score. But of course, you have to do it to know if the PSA, the doctor will further evaluate you to know if the high PSA is from that or whether it is from, prostate cancer. Once you've done the PSA score, you've done the biopsy, then there are other routine tests you do. The results from these ones will guide the doctor whether you should go further, do chest x-ray, do routine blood investigations, and then basically have your baseline values. Of course, we determine whether more specific tests like ultrasound, all these things are done, CT scan, MRI, PET-CT study, These are the ones you really try to do. It's like total body scan to see if the cancer cell has gone beyond the prostate gland and then gone to other parts of your body, other bones of your body, or anywhere in your body. And it's when you do these things, when the doctor does all those things, that he will be able to advise you on the correct management procedure. Whether there are so many, when we will talk about treatment of prostate cancer, I will outline to you, the different forms you can use. But you need all these tests to make correct diagnosis and make up your mind the way to go. Please, I keep saying, we in the Community Positive Health Attitude Initiative, we keep saying that we love you. And we are so sure your relatives, your family, they love you so much too. Please, do the needful. Open your eyes and let's fight this prostate cancer. Go for screening. You have so much things you can still do for humanity. Honestly, you do. And do it. Stay alive. And you can't do these things if you're dead. I've watched many young men, relatively young men, cut down in the prime of their ages by prostate cancer. And this is preventable death. Yes, we pray, but we do all we can to prevent. Do not say it's not your portion. We keep saying it can be anybody's portion. Do the needful. Please, go get screened for prostate cancer. Thank you so very much.